Welcome to Adapt Thinkers. Pediatric Psych are very common and mostly tested on the NCLEX and NCLEX group. They use the same disorder and they test you over and over. In this video, I'm going to show you how to recognize each disorder, childhood disorder in psychiatry. And then we do SATA question to consolidate so that you will never get trapped. Stick around and let's get to it. First thing, I'm going to give you the concept in the very straightforward. Take a pen and paper. When you see ADHD, attention deficit hyperactive disorder, what should you think? Medication and growth. What is the question going to be? It's about not diagnosis, but they're going to ask you about how do you manage it? They don't want you to know about diagnosis. How do you care for this patient? What is the problem? These are the key facts. I want you to write it down. Based on a diagnosis, they have attention issue, hyperactive, and they have impulsivity. What do you do? First thing you do, medication. Stimulant at the first line to slow the kid down. Then what? You have to know how to give the medication. This is what the NCLEX will test you. Write it down. You give the medication in the morning because he's going to keep the kid awake all day. Therefore, if you give it after 6 o'clock, the kid is not going to sleep. So that's a trap. Give it in the morning. This is a stimulant. It causes the kid not to eat, decrease appetite. Therefore, growth retardation is a big problem. So make sure we're checking their appetite. Make sure we're checking their height and weight. Growth chart will be given to you. If you see those symptoms, you have to intervene as soon as possible. Remember, it's a stimulant. Therefore, if their blood pressure goes up, the tachycardia, diaphoretic, those are traps. Don't pick it. Pick always height and weight and appetite. What you do, because of the attention issue, give them a structured environment. Very short, structured environment is better than creating chaos with the dissipation. NCLEX pattern, like I told you, we want to know growth. We want to know timing. When are we giving the medication? In the morning. And we want to know behavior. How do you control it? Structured environment. This is all. If you know this slide, you know attention deficit hyperactive disorder. Next condition, autistic behavior, right? Autism Spectrum Disorder. This is what they use. It's a spectrum. There's a lot of it. But what should you take from this lecture for this specific condition? Routine. They're going to ask you about routine. Don't stimulate this patient. Prevent overstimulation and make sure everything is routine. And this is the concept. What do you think? How do you recognize it? For eye contact. They don't want to look at you. The speech is delayed. You repeat things at the same time multiple times. That's how their brain is wired. Overstimulation causes a problem. Sensory stimulation. You don't touch these kids until they invite you. You have to make sure they know what you're going to do. So they need prediction. They want to know when you're going to do something. What is the NCLEX want you to know? Exactly the same thing. I'll summarize it. Consistency, predictable. They know what is going to happen. And when you're talking to them, no abstract. Just say what the thing is. Concrete behavior is good for them. Concrete language. No surprises, no abstract, just concrete language. You conquer number 2. This one, I put it together because this is where the NCLEX confuse you. ODD and conduct behavior. This is where the NCLEX will get you multiple times. How do I summarize it for you? NCLEX will confuse you. If this confuses you, write it down. These are the key points in a table form. Oppositional defiant, that's the key. Oppositional defiant disorder means I'm going to argue with you. I'm going to oppose you. I'm very defiant. I'm going to talk back. I'm like, no, you can't take over me. But I'm not going to cause any problem to you. I'm using my words. I argue. I'm very defiant. I will talk back to you, but I'm not going to cause any harm to you. Compared to conduct disorder, I'm going to steal your thing. I'm going to kill your animal. I'm going to destroy your property, and I'm going to hurt you. You see the difference? One argue, one take action. And therefore, Conduct disorder lead to what? Antisocial disorder. That's what I want you to take from this slide. This is the big NCLEX one. Apart from ADHD, this one, they will confuse you. Summary. Oppositional defiant disorder, they are mafia. They talk, no action. Conduct, I'm not talking, I'm doing you something. Action, they're very, very dangerous. This is the key you should remember. Now, separation anxiety, this is key, right? This is very key in kids. Think about it, they fear about something. In that position, you leaving them. So what would they do? They're not going to go to school. They will feel like they tell you they're having nightmare, and they will have somatic complaint, constipation, diarrhea, headache, because they don't want you to leave them. So that is the somatic complaint. If you have issue with that language in question, you mix it, that's what they mean. The things that they're going through, they don't want to show you, so they feel like they're sick. So my leg hurt, I have headache, those kind of things. My stomach is heavy, I don't want to go to school. That's separation anxiety. What would the NCLEX question want to pick? Don't separate the kid. Do it slowly. No forced independence, gradual separation and reassurance. Now, depression is also key. Not everybody is depressed when they come to kids. And how do you recognize them? They are not sad like adults. They don't look depressed. So be careful when you see a question like that. And the key, grades are going down. You got to know that's a clue. Guy is A+, all of a sudden C. They are irritable. You touch them, they're screaming. They can't sleep anymore, and they're hopeless. Those are the key, but not, you won't see a sad face all the time. Always irritability and decline grade are the two keys before sleep and hopelessness. Assess safety. Selective mutism. This is key. This is not the language problem. The kids speak normally at home, but when they go to certain places, they can't talk anymore. It's not because they have language, that's where they will trap you, NCLEX trap. It's not the language problem. You don't need to go see somebody to help them with language. It's anxiety problem. So selective mutism is anxiety. Psych for the NCLEX and nursing school can be very difficult. What do you need to do? Don't memorize it. Look at the pattern. In this video, I've given you every little thing that you need to put it together. I call it buzzword. This is the way I adapt NCLEX teach. Now, Tourette syndrome, you already know, it's like tardive dyskinesia. It's okay. It can happen before 18 years old. But the key concept is you have to have motor and vocal tics. So speaking tics and also motor. You're moving like a certain way. You're moving your neck, lips marking. All of them have to be together before we can diagnose it. In summary, this is the thing. Attention deficit hyperactive disorder. Don't forget one thing. The time you give medication and what you watch for, growth, appetite, and height. Autism, make sure everything is routine, is predictable, the person know you coming. Oppositional defiant disorder, all talks, no action. Once again, all talks, no action. They will argue with you, they will temper tantrum, everything, but they will never touch you. They will never violate your rule, never kill your animals. Unlike that, conduct disorder, hey, they don't talk, they're going to harm you. Separation is all about fear, not language. And depression, I'm not going to be sad. I'll be irritable sometimes. And then safety is the key. If you know these 8 key concepts, then apply it for this question. First question, a nurse is caring for a school-age child diagnosed with ADHD. SATA question, selected apply. Which intervention are appropriate? Selected apply. Which one do you want to pick? We talk about the key concept, application. Administer the stimulant medication in the morning. Encourage highly stimulating classroom environment. Monitor height and weight. Provide short, structured activities. Restrict physical activity to reduce hyperactivity. What do you think? Stop the video, put down your answer as usual, and let me know, and keep your score. These are 8 questions. If you answer all of them, you know the concept. We know We got to give the medication in the morning so that we don't cause overstimulation at night. The kid is hyperactive. We should not give them stimulating environment. Since we're giving them medication, we got to check their growth. Height and weight is good. Short, structured activities, yes, so that they can pay attention to that. We should not restrict physical activity to reduce hyperactivity. This is how they deposit their energy. Give them something to eat. Give them something to throw. But in the structured environment, don't restrict. This is a trap. The NCLEX will use to trap you. So 5 is the wrong answer. Don't pick it. Just because they are hyperactive doesn't mean we should not let them do anything, restrict their physical activity. Therefore, the right answer is what? 1. Therefore, the right answer is 1, 3, and 4. Did you get them right? I know you did. Next question. And this is planning care for a child with Autism Spectrum Disorder. You know the key concept applied, which action are appropriate. It's a selected apply. We talk about the concept. What do you think? Stop the video. Pick your answer. Let me know. Maintain a consistent daily environment. Use figurative language during communication. Reduce environmental stimuli. Prepare the child before transition. Encourage group social interaction without preparation. What do you think? This patient, autistic spectrum. What do you want to do? Select or apply. Put your answer in the comment. Stop the video, pick yours, and then keep your score. Consistency is key. Therefore, return is fine. I said concrete, no abstract. Figurative is not concrete. Therefore, bad. Use concrete communication. Reduce stimuli as much as possible. You got to prepare the child before transition. Transition creates anxiety. If a nurse is taking over, you got to tell the kid that somebody is taking over. Your nurse person is going and introduce that person to the patient so that they know they already prepared. That's good. You cannot encourage social interaction without preparation. Same thing. We should encourage social interaction. Don't restrict them just because of their language. But before you do that, prepare the kid that reduce anxiety. Therefore, 1, 3, and 4 are your right answer. What is your score so far? And this is educating parent of a child with oppositional with defiant disorder. You know them, all talk, no injury. Which statement indicate correct understanding, right? We will set clear and consistent rule. We should ignore dangerous behavior. We will avoid power struggle. Punishment should be unpredictable. Positive reinforcement is helpful. What would you do if you have a patient with ODD? They are very defiant. They don't obey, but they're not going to cause energy. They will argue with you. What are you going to do? Which answer choice you pick? It's good to set clear, consistent rule that if you do this, this is what you're going to get. You should not ignore dangerous behavior. We will avoid power struggle. Why? Because when there's power struggle, that wasn't defiance. Punishment should be unpredictable. No, it should be predictable that they know it's coming. If you don't punish them sometimes and you punish them sometimes, then they will throw temper tantrum. Let them know. If you do this, you're going to get this. Positive reinforcement is good. If they're doing something good, help them. So 1, 3, and 5 are your right answer. You see how the concept can be used. They're not going to trap you. It's pattern recognition. If you pay attention to how the question is framed, you can see that you can answer it without any problem. It's a select or apply. SATA question on psychiatry on child disorder. Which findings support this diagnosis? Select or apply. Same thing. And then reassesses what? And then assesses a child with suspected conduct disorder. Which findings support the diagnosis? Cruelty to animal. Is that what they do? Frequent temper tantrum. Lying and stealing. Destruction of property. And separation anxiety. What do these people do? Don't confuse you with ODD, oppositional defiant disorder. These are conduct disorder. Pick your answer, let me know. But the clue I give you, the concept I give you, stop the video, pick the answer before I reveal it. But the concept I give you is what? They don't talk, they break rules. They are like antisocial and they're bad people in terms of animal, stealing your property. They don't care. Violate your rule. Therefore, they're going to kill your animal. They're not going to do temper tantrum. They have no time for that because they don't talk about anything. They will steal your thing and they will destroy your property. They don't have separation anxiety. You see how I'm doing using the question? These are approach SATA question, bring the content, and then use it to analyze the question. You can see that the question is easy. You pick the answer easily. And then it's caring for a child with separation anxiety disorder. That's the key you're going to focus on. Which behavior I expected, selected, apply. They refuse to attend to school. They have nightmare about being separated. They have aggressive behavior towards peers. They have physical complaint when separation is anticipated. And they have what? Delayed speech development. You know this. I try to make the concept straightforward as much as possible. Then when you see the answer choice, you can see that it's popping out like a candy. Separation anxiety, select or apply. I'm not picking everything. Expected finding. It has to be consistent with separation anxiety. What do you think? Somebody is leaving me. What am I going to do? That's all. I won't go to school because I don't want to be separated. I will say I have nightmares so that mommy will be around. I'm not be aggressive towards peers. I'm not conduct disorder. I'll start having diarrhea, physical complaint, constipation, headache, because I don't want to be separated. This is not a speech problem. That's all. 1, 2, and 4. Right answer. What are your score? 5 questions so far. And has evaluate the child who speak normally at home but remain silent at school. What do you think? What is the diagnosis? Right? Selective mutism. Which statements are accurate? Selective mutism is what? This disorder is anxiety-based. Is it anxiety-related? The child is being intentionally defiant. Is being defiant? Speech therapy is always required. The child understands spoken language. All speech will improve outcome. What do you think? There's a bunch of trap there. Don't get trapped. Go with you speak normally, but at certain places in school, it's not speaking. And you know, is what? Selective mutism. And the key concept is what? Pick your answer, let me know. Stop the video and learn from it. Select your answer and see, and so that you can keep your score. I can tell you, it's an anxiety base. If it's an anxiety base, it cannot be a language. Therefore, child understand language spoken. That's good. You see how I'm using that to answer the question, right? The kid understand it, and it has nothing to do with he can speak. The child understand the spoken language, and this is anxiety. This is not intentional. You don't need a speech therapy because number 4 said the kid understand language. You cannot force speech because he can speak. So 1 and 4 are the only answers. This is selected apply, SATA question on the NCLEX for psych. PEDS. And then she's teaching parent about Tourette syndrome, tick syndrome. Which statements are correct? Select apply. Symptoms begin before the age of 18. Both motor and vocal tics should be present. Tics are voluntarily behavior. Stress can worsen symptoms. The disorder always resolve in childhood. I create this question. I use the language. NCLEX is not going to give you the same thing, but it's the same concept. They may write it a certain way to disguise it, but it's the same. We already know Tourette syndrome is tics. They have to happen before you are 18 years old. There are 2 things that has to happen. Like I told you, you got to have modal movement tics, and you got to talk about it. Verbal tics, right? It's not voluntary. It can be voluntary. They're there and they're smacking their head. They don't want to do that. If they are stressed, you will see it more. So stress can worsen it. It does not always resolve in childhood. It may persist. So 1, 2, and 4 are your right answer. And the last question. And this is assessing adolescent for what? Depression. You know the key. They're not going to be sad, which finding are concerning. Selected apply. They are irritable. They decline in school performance. There's increased interest in activity. There's change in sleep pattern. They express hopelessness. What are the key concepts of childhood depression? That's all. I know you're going to get them right because this is straightforward, right? I told you they're not going to be sad. They're going to be irritable. The school performance will show from A to C. They're not going to have interest in things, right? They're not going to sleep well, and it will show hopelessness. These are 8 childhood disorder that you should know. Specific childhood disorder you should know on psych for the NCLEX and nurses school. If the video help you, just put the like button and say, hey, I like this video. I finished. I got 8 out of it. Want more? I'm going to link a video that will show up at the end screen, and then click on it. You learn more about psych